So I don't think a lot of people know, but Maryland is a direct access state for physical therapy, meaning that for the majority of people, they can pursue physical therapy without having a direct referral or script from their physician. Now, there are exceptions to the rule. There are some insurances that do require that, but for a large majority of the individuals, they're able to go to physical therapy and have that be their first medical provider that they see. So direct access is great because I think it does provide a lot of benefits for the patient and also the PTs themselves. For the patients, it removes the barrier to entry to actually getting into the doors of PT. So I think a lot of times there's many conditions where we know the individual is going to end up at physical therapy. And if they're direct access, they don't have to jump through all the hoops of seeing their primary care, seeing an orthopedic, undergoing imaging, going through some of those preliminary steps that at times would often precede getting into PT. But with direct access, you can bypass all that and just go directly into the physical therapy office and start getting treatment and getting your evaluation done. With direct access, there's benefits, but there's also some significant just roles and responsibilities from the physical therapy standpoint as well. I think we need to recognize and appreciate that if we are potentially somebody's first contact point in the medical, health, wellness, or fitness world, we need to make sure that we can actually appropriately triage who is relevant for us to be working with versus who may require another set of eyes for them. And is this individual actually within our scope of practice, or do we need to recognize a condition and tag out and refer out to another appropriate provider when necessary? So I think direct access, it's a very valuable tool and a very valuable resource that we have within our state. I do think that it takes not only a competent, but a confident physical therapist as well to take full advantage of it and actually utilize it to the best of their ability, meaning that they're comfortable being potentially that first contact with the patient. They're competent to be able to recognize when they are not the best individual to work with the patient at that time and know who and where to refer out to. But also being comfortable working with somebody on that level of acuity that they may have with whatever the injury or medical condition that they have going on is. And I know some PTs, especially if you're new out of school or just new in that setting, if you don't have the reps and the sample size of individuals that you've worked with, it can be a little daunting at first if you're the first person they're seeing and you need to develop that plan of care with them. But as with all things, you get more comfortable with reps, you get more comfortable with time. And I do think that is something that from an educational standpoint, they are pushing that differential diagnosis and how to intervene early on or tag out and refer to the most appropriate person.